So can you give us an example of how the Hexagon has helped you get your head around a project you've been working on?
Yeah, sure.
Thanks.
So we use this framework on a project called the Mainstreaming Assisted Living Technologies Project, which was MALT. It was a 3-year study commissioned by the Technology Strategy Board that basically our lifestyles have changed so much, so quickly in regards to technology. So think about how we do online shopping, how we use mobiles every single day, how we can use these things. For example, my gym has just introduced an app where you can keep all your workouts history on the app, and how you can do so much with technology just in your pocket. And how we can use that technology within the context of healthcare. So it is something that is happening, and it's happening more. But basically, the Technology Strategy Board was concerned with why is technology not getting into the NHS, for example, at a rapid pace as it is in just wider society. Because the benefits of it are so huge. We can monitor our own health data. It can help us monitor our diet. It's a data minefield that the NHS could maybe use, and it could enhance the life of patients and, for example, care for people more remotely at home, so that things like having to go to the hospital all the time, you don't have to. You can actually have data that you fill in, and it gets shared with a medical professional over in for example, a telehealth centre. So it was about understanding how we can use telehealth within the NHS and looking specifically at why that hasn't happened. So using the Hexagon as a framework for understanding all the system and the complexity and bringing it all together.
Great. Well, could you just walk us through the Hexagon, maybe node by node, and highlight one or two things that jump out at each node and why? And that'll help us understand thinking about this problem more systemically.
Yeah, so we had 4 NHS sites that we went into, and all of those sites had used telehealth. So we basically used the Hexagon. So we did a number of interviews. It was a huge amount of interviews, 126, I think, with staff and patients and senior people within the NHS, like leaders, for example. And we also included some interviews with the people that make telehealth, so those in industry. So obviously some of the areas around the Hexagon can change slightly depending on the project. But we obviously looked at people, infrastructure, technology, culture, processes and procedures, and goals, visions and values. And we took this holistic approach because we wanted to understand the concept of business models and how telehealth gets into the NHS.
Okay, great. So just dive into one of those nodes and something that jumps out.
So imagine how we buy mobile phones. We buy a mobile phone, we keep it for 2 years, and then our mobile phone company says to us, here's you get an upgrade within 2 years' time. What we were finding in the NHS was that the technology was sold in such a way that they purchased the unit outright. So you imagine all the changes to how mobile phones have changed over the past 5 or 6 years. The NHS was trying to use equipment that was 6 years old, and obviously times have moved on. So technology was a huge part of, and how that technology was purchased and actually maintained was a huge area on the Hexagon that we delved right into.
So I can see how the technology itself fits within sort of the technology node, but the idea of the business models almost veers into the infrastructure.
Definitely, and also the processes and procedures. So one of the main things that we found was a disharmony between, for example, how the processes and procedures within the NHS, for example, procurement and the way that the NHS is given its money and how it budgets, really weren't set up in a way to support alternate business models. So, for example, if you think about, again, the mobile phone example, or, for example, Power by the Hour model by Rolls-Royce, where rather than selling the engine as a unit, they sell the amount of hours spent in the air.
As a service.
As a service, yes. So what we were finding is that the NHS was procuring equipment as a unit, whereas actually what we were finding is that meant the technology became outdated very quickly, it wasn't maintained, there wasn't the support systems in place to basically maintain it, and that really was part of linking to the goals in the system and the procedures around procurement, for example.
So I can understand that. So it's the goals of teams like procurement are misaligned with the care team goals.
Yes.
So can you talk a bit more about goals, perhaps?
Yeah, so in terms of goals, there were definitely conflicting objectives. So, for example, the NHS receives its budget in terms of how many people actually go through its door, which is a little bit kind of, it has a model of getting someone better rather than having a mindset of prevention. So if you're rewarded for how many people you treat, your system isn't incentivized to stop people from coming through your door. And the telehealth really was more of a tool for prevention at the early stages of a disease where, for example, if somebody is overweight, you can perhaps stop them developing diabetes, whereas the current system and the care goals, for example, were aimed at helping somebody who had already developed diabetes.
That's a really good example. And can you talk a bit about maybe people and culture?
Yeah, well, this was really interesting in this particular project. So, for example, there was a lot of, really, the success of the telehealth was down to the frontline staff. Where we found champions of telehealth, where people were really kind of like sold on the benefits and how it can help prevent people becoming worse or even developing a disease, they were really passionate about it and were really enthused and to learn about it. But there was a lot of people who were scared of telehealth as frontline staff. They felt that they had gone into this profession to nurse people, face-to-face contact, patient bedside manner, for example, and they were quite scared that using telehealth would mean that they would be behind a telephone in an office rather than seeing patients face to face, and they were quite concerned about the safety but also that sort of intangible care that they give to patients that's just about that face contact. So obviously where they had those perceptions of telehealth as being something quite negative, it really had a huge those attitudes of those people had a huge impact on the success of telehealth being embedded into the care plan.
So what I'm hearing, if I tell me I've got this right, that there's variance. There's some people who are totally on board,
Yeah.
and there are people who are strongly resistant for a variety of reasons, but depending on which sort of micro team you work in might determine the culture within that team.
Definitely.
And the fact that there's enough people that are anxious about the technology means that it would be really difficult to have a culture that's uniformly pro
Yeah.
the next thing.
Yeah, so obviously there are micro cultures, so a team would have a culture, and if you've got lots of these champions, that team would be more progressive in the way that it used telehealth. But then what you've got to remember is that the telehealth is a huge organisation, so you have micro cultures embedded in a macro culture. And unfortunately, for example, if you read the literature that's out there, so the NHS has just done this huge 5-year forward review, which looks at the future of the NHS and how we really do need to make changes. So, for example, if we carry on working the way we are, we're going to have a £20 billion deficit by 2021, which isn't that far away. So we really need to employ new technologies and how we actually work very differently. So it's really worthwhile kind of trying to understand these different cultures and how we can change the overall culture of the NHS to be geared in such a way that it supports the use of these preventative technologies.